So thread lifts are actually procedures in where we insert specialized threads into different parts of the face or the neck to give our patients a lift. We have a multi-step approach to actually manage our patient's comfort level. We initially use topical numbing agent on the skin on the areas where we are going to introduce an intralesional injection of numbing agent again. This makes the first injection already very comfortable. Thereafter, we are actually numbing the entire face using a cannula. So because we are using a blunt needle, even when we are actually introducing the anesthesia into the face, it is actually much safer than if we were to do it using a sharp needle, as the blunt needle carries very minimal risk of puncturing any vessels or nerves. Through the years, we have sourced through all the different brands of threads and all the different threads to actually choose two good brands that we are now using for all our patients. We feel that these two brands are actually the safest and they give the longest and best results for all our patients. One of them has got what we call multi-directional barbs, while the other uses a cone technology. The reason why we have two different kinds of threads is so that we can cater to all kinds of different patients, from people who just want a little lift to those who are heavier and they are looking for a more pronounced and drastic lift. Depending on the patient's condition, the thread lifts may last anytime from between a year to 2 years. In our clinic, what we do is we have a very specialized post-treatment protocol that actually helps our patients prolong the results to up to 2 years. There are many reasons why we would actually encourage our patients to do a thread lift, or why the patients would want to do a thread lift. The obvious ones would be patients feel that the face are a little bit saggy and they want it to be a little bit lifted. But for us, we do like to use thread lifts also because after lifting, our patients actually find that the cheeks are a little bit fuller, they get less of these laugh lines, the corners of the mouth are lifted, and their jowls actually flatten without actually doing any Botox or fillers. So to me, it is actually my first treatment for patients who are a little bit flatter around here, or patients who come in who think that their laugh lines are a little bit deeper. For the thread lift, it is important to look for doctors who have done it many times and who have done it well, because it is not just merely a lift of your face. We have to look at proportions, and we have to also tailor the treatment to suit the patient so that the patient gets the results that they want, be it a drastic lift or just a tiny little nip and tuck to make them look fresher.